All right, these notes are for your PBS course file. The CBC test is a complete blood count test, and it's one of the most common ones that you're going to get when you give blood at the hospital in order for your doctor to see what's going on. All right, so normal ranges, and you're going to fill in your patient measurement from the activity. WBC, white blood cell count, the normal range can be from 3,400 to 9,600. And this is male and female. We're just going to run it across the board here. Red blood cell count for males, the normal range is 4.32 to 5.27 or 5.72. Normal range for females 3.90 to 5.03. Hematocrit, normal range for males 38.3 to 48.6. For females 35.5 to 44.9. Hemoglobin, the normal range for males is 13.2 to 16.6. The normal range for females is 11.6 to 15. Platelet count, normal range for males, 135,000 to 317,000. Normal range for females, 157,000 to 371,000. So when we're looking at the CBC test, the doctors are looking to see if you fall within the normal range. And here are some possibilities of what might be going on if your levels are high or low. For white blood cells, because that's dealing with our immune system and usually probably an infection, high levels can indicate an infection. It can indicate an allergic reaction. In some instances, it can indicate cancer. Low levels of white blood cells could indicate a disease or dysfunction with your bone marrow. Red blood cell levels. If you have high levels of your red blood cells, that might be because you are in an environment where you have a decreased amount of oxygen. So we make more red blood cells. Red blood cell production increases to keep up with the oxygen needs. So if you're like high up in Denver where you're not going to have as much oxygen density, then you're going to end up wanting to make more red blood cells in order to be really efficient with the amount of oxygen that you get with every breath. Low red blood cell levels might indicate anemia. Hematocrit. High levels of hematocrit might indicate dehydration because we have less plasma, less of the watery part of the blood. Low hematocrit levels might indicate an illness or an infection. Hemoglobin, high levels, your body needs more oxygen. So this could be because of the environment that you're in, the altitude that you're at. If you're a smoker, diver, swimmer, then we want to be as efficient with the amount of oxygen that is in every breath as it is, so you're going to have higher levels of hemoglobin. Low levels of hemoglobin, you might have blood loss, you might have a diet that's really low in iron. Platelets, high levels might mean excessive clotting. Low levels of platelets, you might have some sort of dysfunction or disease where you have easy bruising, fatigue, excessive bleeding, or clotting disorders. The other insert gives you the normal ranges for these items, and you're going to fill in your patient's measurements. On this one, sodium, potassium, chloride, sodium, calcium, potassium, chlorine, chloride. That's this, and there's calcium right there. So, and I just put a sticky note on the back of this. So these are our electrolytes. They're found in blood, urine, and tissues of our body. They help to keep the water balance. They help to move nutrients and wastes, and they're important for the nervous system and for muscle function. Okay. All right. So a couple of the other items that are on here. So number one, this first one is glucose. Number number 2, the second one, BUN. So number 1, glucose. If that's high, that means you are at an increased risk for diabetes because glucose is a simple sugar that provides our energy, but high glucose levels are going to tell you that, hey, we might want to do a GTT test, especially if they're consistently high. The second one, the BUN, that's blood, urea, nitrogen. These are waste products that are filtered out by the kidneys, and if these levels are high, these levels are indicators for kidney health and function, and they can tell you how well your kidneys are working. All right, so cholesterol panel, normal, at risk, and this is going to be your patient information that you're going to add in. Total cholesterol, normal people, healthy cholesterol level is below 200 for a total value. If you're 200 to 240, then that means that you're at risk, and above 240, that's high cholesterol. LDL, we want those numbers below 100. 130 to 159 is at risk. When you get up to 160, that's high. HDL, we want those numbers above 60. And you're at risk when those numbers are below 40. Hematocrit test. So the hematocrit is taking a look at the ratio of red blood cells to plasma that is in your blood. So we'll take a measurement of red blood cells to the total amount of blood and use that number to go back and get your hematocrit value. So on my normal test tube right here, my red blood cells were 4 milliliters. The total was 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. So red blood cells divided by total times 100 gives me 44.4. So if I come back over here for my hematocrit, and I can see whether it's male or female, that's going to fall within the normal range. So here's your patient's hematocrit. You're going to work that out for your patient.